Picture this: you're checking your bank account tomorrow morning and discover not one, but two deposits of $5,400 each, totaling nearly $11,000 in direct payments specifically designed for Social Security and SSDI recipients. This isn't a fantasy or wishful thinking. It's the reality that millions of American seniors are about to experience thanks to historic legislation that just passed the House of Representatives with overwhelming bipartisan support. If you're currently receiving Social Security or SSDI benefits, the next few minutes could reveal how you'll be receiving the largest direct payment in Social Security history. Don't let this life-changing information slip by. Make sure to subscribe to our channel and ring that notification bell right now so you'll be the first to know about every update regarding these massive payments that could transform your financial situation overnight. The House of Representatives has just approved the most significant direct payment program for seniors since the creation of Social Security itself, establishing what congressional leaders are calling the Senior Economic Security Act. This groundbreaking legislation authorizes two separate rounds of direct payments, each totaling $5,400, specifically targeted at Americans who are currently receiving Social Security retirement benefits or Social Security disability insurance payments. The bill passed with a remarkable vote margin that demonstrates unprecedented unity around the need to provide immediate financial relief to the nation's most vulnerable senior population. What makes this legislation particularly revolutionary is its recognition that traditional Social Security adjustments simply haven't kept pace with the real-world expenses that seniors face every single day. Have you ever calculated how much your grocery bill has increased over the past 3 years compared to your Social Security cost of living adjustment? The disconnect between official inflation measures and the actual price increases that seniors experience for essentials like food, medications, and utilities has created a crisis that demanded immediate congressional action. The first round of payments will begin processing within 90 days of the bill's final passage through the Senate, which is expected to occur within the next 6 weeks based on current legislative schedules. Recipients won't need to apply or submit additional paperwork because the Social Security Administration will automatically identify eligible individuals using existing benefit databases. This streamlined approach eliminates the bureaucratic delays that have historically prevented seniors from accessing emergency financial assistance when they need it most. Eligibility for these direct payments encompasses a broader range of Social Security recipients than many previous programs. Anyone currently receiving Social Security retirement benefits qualifies automatically, regardless of when they began receiving benefits or the amount of their monthly payments. SSDI recipients also qualify automatically, recognizing that disabled individuals often face even higher living expenses than traditional retirees due to medical costs and specialized care needs. Surviving spouses who receive Social Security survivor benefits are included in the eligible population, ensuring that widows and widowers aren't overlooked during this historic expansion of senior support. The second round of payments, scheduled to process approximately 6 months after the first round, includes additional eligibility categories that weren't part of the initial distribution. Seniors who turned 62 during the payment period will become eligible for the second round, even if they weren't receiving benefits during the first distribution. This forward-looking approach ensures that newly eligible seniors aren't penalized simply because their birthday occurred after the initial payment processing began. Congressional budget analysts have calculated that these direct payments will inject over $120 billion directly into the American economy through senior spending, unlike other economic stimulus programs that may see recipients saving or investing their payments. Research consistently demonstrates that seniors spend direct payments immediately on necessities, creating an immediate economic multiplier effect that benefits entire communities. When seniors have additional money to spend, local grocery stores, pharmacies, medical providers, and service businesses all see increased revenue that supports local employment and economic activity. The timing of these payments addresses critical financial pressures that many seniors are experiencing right now. Heating and cooling costs have skyrocketed in many parts of the country, forcing seniors to choose between maintaining comfortable home temperatures and paying for other necessities. Prescription drug costs continue rising faster than Social Security adjustments, leaving many seniors rationing medications or skipping doses to make their prescriptions last longer. Housing costs, whether rent or property taxes and maintenance for homeowners, have increased dramatically and show no signs of stabilizing at levels that traditional Social Security benefits can adequately cover. Healthcare implications of these direct payments extend far beyond immediate bill-paying assistance. Many seniors have postponed dental care, vision care, and hearing aid purchases because these services aren't fully covered by Medicare and represent significant out-of-pocket expenses. The direct payments provide seniors with resources to address these accumulated healthcare needs that directly impact their quality of life and long-term health outcomes. How many seniors do you know who have been putting off necessary medical procedures or equipment simply because they couldn't afford the copays and deductibles? Rural seniors face unique challenges that these direct payments will help address, particularly regarding transportation and access to services. Many rural areas have limited public transportation options, making it expensive for seniors to travel to medical appointments, grocery stores, or other essential services. The direct payments can fund transportation solutions that urban seniors might take for granted, from rideshare services to vehicle maintenance that keeps seniors mobile and independent. The legislative process that brought these direct payments to reality involved extensive testimony from senior advocacy groups who documented the growing gap between Social Security benefits and actual living costs. Lawmakers heard compelling stories from constituents who described having to choose between heating their homes and buying groceries, or between purchasing prescription medications and paying rent. These real-world testimonies provided the political momentum necessary to build bipartisan support for direct payments that go beyond traditional Social Security adjustments. Banking and financial institutions have been working closely with the Social Security Administration to ensure smooth processing of these unprecedented payment volumes. Most recipients will receive their payments through the same direct deposit arrangements they currently use for Social Security benefits, minimizing processing delays and ensuring secure, reliable payment delivery. Recipients who don't currently use direct deposit will receive paper checks, though the Social Security Administration strongly encourages transitioning to direct deposit to expedite payment processing and reduce the risk of stolen or lost checks. State-level coordination ensures that these federal direct payments complement rather than interfere with existing state benefit programs for seniors. Each state has designated liaisons working with federal administrators to prevent unintended consequences that might affect seniors' eligibility for state-funded programs like Medicaid, food assistance, or housing subsidies. This coordination reflects lessons learned from previous federal programs where lack of communication between federal and state agencies created confusion and unintended benefit reductions for vulnerable populations. The application process for these payments is intentionally minimal, reflecting congressional intent to get money to seniors quickly without bureaucratic obstacles. The Social Security Administration will use existing benefit records to identify eligible recipients and process payments automatically. Seniors who believe they should be eligible but don't receive payments within the expected timeframe can contact Social Security directly, but the vast majority of eligible individuals will receive their payments without any action required on their part. Security measures protecting these payments include enhanced fraud monitoring and direct communication with recipients about payment timing and amounts. The Social Security Administration will send notification letters to recipients before payments are processed, providing specific information about payment dates and amounts. This advance notification helps seniors distinguish legitimate payments from potential scams that unfortunately target seniors during periods of benefit changes or enhancements. Long-term implications of this legislation extend beyond the immediate financial relief it provides to current recipients. The successful passage of these direct payments demonstrates renewed political recognition that Social Security benefits alone aren't sufficient to provide dignified retirement security for millions of Americans. Future congressional sessions are likely to see additional proposals for permanent Social Security enhancements, expanded Medicare coverage, and other programs that address the systemic challenges facing America's aging population. Regional economic impacts of these payments will be particularly significant in areas with high concentrations of seniors, including traditional retirement destinations and rural communities where seniors represent large percentages of the local population. Local businesses in these areas should prepare for increased customer traffic and demand as seniors receive their direct payments and begin spending on deferred purchases and accumulated needs. The international attention this legislation has attracted highlights America's commitment to supporting its senior population during challenging economic times. Other developed nations are watching closely to see how direct payments to seniors affect economic activity and senior welfare, potentially influencing similar programs in countries facing comparable demographic and economic pressures. Family members of Social Security and SSDI recipients should be aware that these payments belong exclusively to the benefit recipient and cannot be garnished or seized for most types of debts. The same federal protections that apply to regular Social Security benefits extend to these direct payments, ensuring that seniors can use the money for their intended purposes without interference from creditors or debt collectors. Preparation for receiving these payments should include verifying that your current address and banking information are up to date with the Social Security Administration. Recipients who have moved recently or changed banks should contact Social Security immediately to ensure their payment information is current. The Social Security Administration has expanded its customer service capacity to handle increased call volumes related to these payments, but updating information proactively will prevent delays and ensure smooth payment processing. As we've explored this historic development in Social Security policy, remember that staying informed about benefit programs can mean thousands of dollars in your pocket. Subscribe to our channel to ensure you never miss critical updates about programs that could change your financial future. And share this information with every senior you know who deserves to receive these life-changing payments they've earned through decades of contributing to Social Security.